Hey guys, it's Gianna, MidwiFay. Today I wanted to talk all about tearing during childbirth, the different types of tears, why people tear, common ways to prevent tears, and just answer a couple questions that I feel like people ask a lot in regards to tearing with childbirth. Let's get into it. As always, I want to encourage you, please like this video, subscribe to the channel. It really helps me know which videos you guys like and what other content you want. So please go ahead and like and subscribe if you haven't already. So let's talk about tearing during childbirth, okay? This is something that a lot of birthing people are concerned about. Understandably, right? To know that your body is going to go through a major event and possibly some trauma. So when we talk about tearing, what are we talking about? There are a few different types of tears people can have. Looking at the female anatomy and structures can help us better visualize how and where people can tear during labor. Commonly, people can tear in the vagina, so in the actual vaginal canal, or at different places in the vulva. The vulva comprises of the labia majora and minora, as well as the clitoris and clitoral hood. So you can have tears in the vagina or in the vulvar area, and these tears can happen depending on baby's position, how fast the birth was, other things. These tears may or may not need to be sewn up at birth in order for them to heal better. Usually tears in the vaginal or vulvar areas do require some level of stitches just because it heals better and it's not as irritating to heal if you did not stitch them. So those are places where you can find tears. More commonly, and what people ask more about, you tear more commonly in the perineal area. This is the perineum. The perineum is the space between the opening of the vagina and the opening of the rectum or the anus. That perineal space is the space where most people tear during childbirth, and there's 4 grades of tears that I'll have a picture of here, kind of talking about the severity and the depth of the tear in the perineum. Does everybody tear during childbirth? I can't say everybody, but I will say that it is common to have some sort of tear during the birth experience. Yes, there are people that do not at all, but commonly, especially if it's your first time giving birth, there will be some sort of tear that happens, but it's a physiologic tear. As long as the baby is coming on its own, and we're going through some of the methods that I'm going to talk about, wherever your body tears is where it needed to tear physiologically in order for your baby to be born. So in this video, I'm going to go over 3 tips to decrease your chance of tearing, or at least decrease your chance of having a very severe tear. One of the things I get asked about a lot in terms of decreasing your chance of tearing is perineal massage, okay? So perineal massage while you're still pregnant. What is that? That is a technique where you can massage the tissues, the skin tissues in your perineal area before you're in labor. Guidelines for perineal massage are to generally start around 35-36 weeks pregnant, to do for 5 to 10 minutes a day, twice a day, as you're comfortable. It involves your thumb and your finger and just kind of massaging. If you can't get down there, your partner can as well, using coconut oil or some gentle lubricant if you want to massage the perineal, the skin tissue there. There are also recently some tools available on the market, most notably Perimom, this one here, where you can use this tool to massage your perineum. Now, it's called a massage, but really it's kind of a gentle tissue releasing technique. It's not necessarily a massage or relaxing. So Gianna, does this help? What does the data say about perineal massage while pregnant? The data is actually pretty good that in a first-time birthing person, doing antepartum prenatal massage can decrease the severity of the tear. So not necessarily won't tear at all, but it can decrease the severity of the tear. And there's also data that shows that for first-time birthing people, as well as people who've given birth before, it decreases the pain at 3 and 6 months postpartum. So although it doesn't decrease the severity or chance of tears in the second or third time birther, it does increase satisfaction at the 3 and 6 month healing postpartum points. So that's good. So I say if it feels good to you to do it, if it doesn't hurt, it's not causing pain, discomfort, you know, do it. Do your prenatal perineal massage. Have your partner get in on it. Why not? You know, you don't have to do it, like I said, but there's only benefits to doing it. So why not do it? My second tip is to avoid pushing too early, and if possible, avoid coached pushing. In labor, once the cervix is completely dilated, about 10 centimeters, the baby starts to descend and really put pressure on that pelvic floor. Most women, even with an epidural, feel the urge to push. Generally, it feels like you need to have a bowel movement. It feels like pressure in your vagina and your rectum, and it's undescribable unless you felt it before. It's undeniable. You will feel the urge to push. There is also something in normal mammalian physiologic birth called the fetal ejection reflex, okay? And that is essentially what it sounds like. The body has a reflex once the baby gets low to a certain point to eject the baby, push on its own. So I really encourage, in cases where we can, where mom and baby are fine and stable and low risk, to wait for the urge to push. Sometimes in the hospital setting, especially with medicated labors, the providers and nurses, we tell you that you're completely dilated and your baby is low and encourage you to push perhaps before you feel the urge to push. Sometimes this is necessary, again, for medical reasons. However, if everyone is stable and doing well, if you wait for the urge to push, then you can work with your body and push in a more physiologic way than coached pushing. What is coached pushing? Coached pushing is when we, the birthing staff, tell you how and when to push. Usually this involves you on your back with your legs up. It involves us counting. Usually we count to 10 3 times in a row. We tell you to hold your breath, suck it in, push down. And this isn't always wrong, and it is effective for many people, again, especially with a medicated and epiduralized labor. However, sometimes when we are urging you to push and we're causing you to bear down and put all that pressure in your bottom without you really feeling it because of the medication, or not really feeling it yet because baby hasn't descended low, it can cause more stress to the perineal tissues and to the pelvic floor than necessary. So once you reach 10 centimeters dilated, I encourage you to use different positions, specifically these kifo positions, knees in, feet apart positions, okay, that really encourage baby to come down and out through the outlet, encourage you to start really feeling that urge to push. And just ask your provider, ask your nurses, you know, if everything is okay, can I wait until I feel the urge to push? Usually in the birth world, we call this laboring down. So yes, you're 10 centimeters, it would be safe for you to push, but waiting for the baby to come down low enough for you to feel the urge to push before you start. Spontaneous pushing can look like that kind of coached pushing if that's what feels right for you. It can look more like a gentle bearing down, breathing out, whatever moves the baby, that's all that matters. Just again, when you have the spontaneous desire and urge to push, it's going to be easier on your body and not have as much tension in the pelvic floor, and that can decrease your risk of tearing or having a severe tear. And my third and last tip, which usually is my third tip, having a supportive provider. I can't say it enough, okay guys? Having a provider who is patient and supportive during the second stage of labor, that's the pushing phase of labor, is key to having a perineum that is supported and perhaps even intact after birth. Depending on your provider, some providers are really hands-on and they are continually assessing progress with their glove, with their hand in the vagina, kind of massaging the tissue gently or vigorously. Sometimes it helps to have feedback to know where to push. But sometimes it causes more trauma to have fingers in there and continually be assessing. There's a lot of other things that we can do. We can put warm compress on your perineum, support the perineum gently, allow for physiologic crowning instead of, once we start to see crowning, really encouraging you to keep pushing, 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 even if the contraction's done. Just, there's a lot of different techniques that different providers use to encourage the perineum to stay intact or not tear as badly. Again, we really can't control whether you tear, where you tear necessarily, but we do play a big role in supporting the anatomy and the physiology and kind of encouraging the least amount of tearing possible. I will definitely say, find a midwife if you can. Midwives are very comfortable with birthing in other positions and encouraging laboring down. We're very well versed in a lot of techniques to support the perineum. And not that OBGYNs are not, it's just they're not trained the same way. They're not necessarily as patient and as hands-off as midwives are, which can benefit you during the second stage of labor and the crowning process. All right, those are my 3 tips on how to avoid tearing or avoid severely tearing during labor. I hope it helps. Please comment down below with, what your postpartum healing experience was like. Did you tear? Did you have a bad tear? Let me know. I'd like to hear about it. All right, thank you so much. I'll see you next time. Take care. Bye-bye.